Okay, so we're going to lead off with Mr. Kerr from Lewis County Lewis County Health Systems. Go ahead, Jay.
All right, thank you, Ryan. Thank you all for being here. Over the last 2 weeks, you've heard or read other health systems in the North Country and Central New York reflecting on the significant impact COVID-19 has had on their organizations. I am here to share we are no different. COVID-19 has had a significant impact on the Lewis County Health System. Like other regional health systems, we are not overwhelmed with caring for COVID-19 patients. Rather, we are extremely prepared to care for the positive COVID-19 patients in our Call First clinic, our physician offices, the emergency department, the medical surgical floor, and the nursing home. We have trained and skilled physicians, advanced practice providers, nurses, CNAs, respiratory therapists, environmental service professionals, dietary professionals, maintenance professionals, and many others ready to serve. We have PPE, ventilators, medications, and are able to surge to 100% capacity if the need arises. We have implemented all executive orders from Governor Cuomo. We have worked in conjunction with county leaders, public health, emergency preparedness, schools, not-for-profits, law enforcement, and others to help flatten the curve. As you know, Lewis County has had 10 COVID-19 positive community members, 2 who spent time in the hospital. This truly reflects the benefit of social distancing, early adoption of screenings, temperature taking, issuing face masks, and ongoing community health education. Collectively, it is working in Lewis County. Look at the numbers. They verify it, they support it. So what's wrong? Rural healthcare systems operate on very small margins. To give you an example, our CFO reported to me that halfway through the month of March, we were on track and projected to meet our budgeted monthly operating margin of $250,000. Keep in mind, our annual budget is $82 million. Ramping up to support state and national directives, though absolutely necessary, was an incredible expense that was not built into the budget, particularly a budget with a razor-thin margin. Furthermore, and more importantly, the inability to continue with elective surgeries and procedures, coupled with a dramatic decrease in ancillary visits, such as labs and diagnostic imaging, and the dramatic decrease in people visiting their doctors, has profoundly impacted volumes across the organization, resulting in dramatic and catastrophic drops in revenue. Let's not lose sight of the fact that the community is also concerned about coming to the hospital for basic, appropriate, necessary, and routine care during this time. Simply, they are frightened, and we can all understand why. The issues we are navigating and are dramatically different from what our colleagues in the greater New York City metropolitan region are facing, though the root cause is the same: the novel coronavirus. At Lewis County Health System, everything asked of my colleagues, my co-workers, has been approached with a spirit of we are all in this together and simply getting it done. My co-workers want to be here for our communities, for our county. Yes, some are afraid, but they are committed to providing necessary healthcare services and stand ready. So, what's wrong? What's wrong, very simply, is the significant decrease in activity. The delivering of healthcare services that generate the revenue that supports the entire foundation of the organization. So here are some basic facts. Operating loss of $1.9 million in March, an average daily loss of $116,000, an 80% reduction in outpatient surgeries. Those are the elective procedures. A 40 to 55% reduction in all other service lines. The first 2 weeks of April are consistent with March's performance. Not very encouraging. So what are the actions? The first action that we have initiated and have over the last couple of weeks, aggressively managing employee schedules, overtime, casual or per diem utilization, utilizing low census staffing. The result, a savings of 39 FTEs, which really reflects the outstanding work by the team. The value of that was well over $250,000 worth of savings. The next action step is really what I think brings you here today. We are implementing the COVID-19 leave of absence, both a voluntary and non-voluntary furlough. Our hope is that we will have an adequate number of volunteers to achieve 35 FTEs. The number of staff impacted will be 35, which reflects 7% of the workforce, but when you add that to the 39 FTEs through the aggressive management of the schedule, at 7%, we will have an overall impact of 14%. The areas of focus for the COVID-19 leave of absence: administrative and finance-related functions, hospital ancillary functions, clinical practices, and acute nursing. The timeline is early next week, which we are projecting to be April 20th through the 22nd. Areas not impacted, and it's important to highlight these areas. The residential healthcare facility, which is the nursing home that is part of our organization. In fact, a real shout out to the team at the nursing home. As you hear some of the horror stories across the country, our team has done a terrific job in keeping people safe, working with the families, using technology, iPads to create contacts. So just good work by many people. The other areas not impacted: home health. In fact, we've seen an increase in activity in home health. Hospice, environmental services department, and the dietary department. The period of COVID-19 leave is targeted for 8 weeks, evaluated in 2-week increments. This approach allows access to the enhanced unemployment benefits. It allows us to maintain health insurance for our colleagues, and it generates no break in service for those in the New York State Retirement Program. Also worth noting, we are, as an organization, aggressively pursuing all federal stimulus programs, but moments before I left to come to today's briefing, I was told that the Payroll Protection Program, which we have submitted 2 grants, has run out of money. So we are optimistic that if Congress decides to continue this program going, that our application will be approved. I spoke with Congresswoman Stefanik yesterday, as well as staffers from Senator Schumer's office and Gillibrand's office. They clearly understand the importance of these stimulus programs, and they're clearly speaking on behalf of, in Elisa's case, on behalf of her district, and the senators on behalf of the entire state. But most importantly, they recognize the differences between the New York City challenge and those of us north of New York City. In addition, today I will be holding and conducting several small group and unit-based staff meetings. What that means is, in this period of social distancing, we all wear masks, and we limit the attendance to 20 people. We do it in an area of the hospital, which is the former adult day health program, where we are able to create a negative pressure room so that we're circulating the air and moving it out. We will also hold these small group and unit-based staff meetings tomorrow. In closing, I would like to acknowledge and thank the CSEA bargaining unit leadership for their active engagement and commitment to working with management during this period of uncertainty and difficulty. Our collective goal is to get all members of the team back to work soon. So it is truly with a heavy heart that I have to make this announcement, and this is the direction that we have to move in. But we need to understand the seriousness of the challenge in the greater New York City region is obvious to all of us. We've seen the tractor trailer trucks serving as makeshift morgues. The challenges are different here, but on a financial level, as equally as harmful to our local healthcare systems and to our local economies and to our counties in all of the North Country region. So with that, are there any questions?
So the meetings that you're having, the small meetings, they are specifically to ask for volunteers. It sounds like you're asking for volunteers first. And if there's not enough volunteers, then there's a certain number in each department. Is that the case?
No, I would say it a little differently, Julie. The purpose of the meeting is to communicate what we're doing moving forward and put some context to it, and also to answer any questions that any staff member would have. And then over the next few work days, begin reaching out to specific individuals in those areas where there's only a one person, in a service. But for those areas where there may be 3 or 4 and we need 1 or 2, then ask for volunteers. So
if there are none, will it go, like usually with unions, it goes on a
seniority
basis, right?
So if no one volunteers, we would then use seniority, those most senior down to less senior, and then coming back, those less senior would come back first. The other goal of the meeting is, with the help of HR, developing a frequently asked question list so that folks can learn how to access the enhanced unemployment benefits, give them the appropriate education around the health insurance that they will continue to maintain, and just talk through the process, as well as reinforce the availability of EAP. I want to emphasize this is truly intended to be short term. We are targeting 8 weeks, fully expecting that everyone will be back. And right before I came here, as you know, the governor's extended kind of our version of the lockdown or stay in place through May 15th. So that's 2 pieces of news that I heard prior to coming here that we'll have to adapt to and implement and work through.
I know you already answered this in your statement, but for the sake of fluidity and generality, we were looking for a CEO to represent the hospitals that are having to make these furloughs. For anyone who's at home saying, oh, but hospitals are busy right now and not really understanding how it works, if you could just make a generalization of why hospitals are doing this. Again, I know you already answered it.
Yeah.
But.
Once we receive the executive order to do no elective procedures, there is the procedure, but then it generates a lot of other activity. That coupled with community members simply being afraid and suddenly not coming for needed and appropriate care. And we have seen that in our health system. So you have probably recently seen we have a drive-in lab service now where you can access the lab without coming into the hospital. We have been seeing over 20 patients a day since the second day it went live. We also have a drive-in service for our OB/GYN service, and as long as it doesn't involve an intimate exam, we are able to do a lot of basic services for women in our community in this space that's occupied by the lab draw station in the morning. We are also working through a process where through registration, pre-registration, if you need some kind of image, you've already registered by phone, you immediately walk into radiology, someone will meet you and bring you back to the imaging suite that you will be occupying. So we're trying to adapt service delivery so our community members don't have to sit in waiting rooms and be concerned that their safety is at risk at the hospital. It's not unique to us, it's happening across all hospitals and including our physician practices. So our chief medical officer is working on an initiative at 2 of our outlying clinics where people will drive into the parking lot when they're ready to be seen by the doctor. The staff member goes out to the car and then escorts them into the exam room so they're not having to sit in the waiting room. So almost as though creating an exaggeration of social distancing so that our patients, our customers, can feel safer and more comfortable when accessing services. All of that will be incredibly helpful, but it'll fundamentally change when the executive order on elective surgeries is lifted. Because in talking with our surgeons and our orthopedists, cases are backing up. Once the switch is turned so we can move forward, we will have about 3 months worth of backed up surgeries waiting for us to do. So we're going to go from this period of very low activity, and then it'll be very engaged for a good several months moving forward.
I was wondering if you could talk a little bit about, so the last time we did an on-camera briefing, I think was on April 7th, and then we had a Board of Legislator meeting that night as well. On April 2nd, I think it was, the hospital had an emergency meeting where they talked about and actually voted on opting out of the Families First Coronavirus Response Act. And then the board actually did approve that at their April 7th meeting as well. I was wondering if you could talk a little bit about the decision making behind that. I know at the time it was said that you needed your staff members and things like that. So I was wondering if that decision making has changed now that you're asking people to voluntarily be laid off.
No, so generally you reflect accurately the process and some of the thinking. A part of the thinking that was fundamentally flawed, and which is why we opted out, was the ability of individuals saying they had no access to child care that would have generated the employer to be responsible for 10 weeks worth of salary. Now, I just reported we lost $1.9 million in March, and we needed to build our surge capacity, so staff were redeployed to different areas, so we needed staff. Then volumes dropped, and it would have been significant to the organization if suddenly we had anywhere from a dozen to two dozen individuals expressing a need for childcare and then still being expected to be paid by the employer. That was just not a sustainable model. So that's really the motivation for bringing forward the request to the managers and to the legislators for the resolution to opt out, and our status as essential healthcare providers was, the opening that allowed that. Also, early on in this process, at least 3 separate times we reached out to staff to evaluate, is childcare an issue? Now, I can't say 100% of the time it wasn't, but overwhelmingly, childcare has not been expressed as an issue. The schools created options. One of our local daycare providers had options. So there were options in our community. So when you put all of that together, it was not unreasonable for us to opt out.
Thank you.
And how long do you anticipate it will take for the hospital to make back the money that was lost in the months of March, April, and potentially further months as this continues?
Yeah, we won't make it all back. We run 2 operating rooms, and our physical plant does not allow us to multiply the number of surgeries in a given day, which is why we have been working very hard on the capital project where we would rebuild the surgical pavilion and go from 2 ORs to 4, and we would modernize medical surgical. And that is so that we can deliver the services in a more timely way, and it becomes the financial underpinning of supporting access to rural health care. So our goal is, to try to break even. And if we can get close to break even after this settles out, I will have considered that an accomplishment. That coupled with, some of the federal programs that are here to help us, and if we can package all of that together, we have a pretty good chance of making that happen.
And then one more from me quickly. Is there any other areas in the hospital aside from employees' pay where you're trimming back?
Be more specific.
If there's any little things like in the cafeteria you're not ordering, or if there's television services, little things like that.
Yeah, no, we're still seeing some patients. We still have a large workforce to engage with and support. No, we're really focused. Basically, expense management is an everyday thing, okay? COVID-19 didn't change that. I started my remarks with, we have an incredibly tight margin. And when you think about it, on $82 million, we will be slightly better than break even at the end of the year. So that means on any given month, a dramatic swing that's negative would impact us for the whole year. So expense management is something we're very aware of, and both the Board of Managers and the Board of the Legislators, that's sort of where the buck stops. I report to the Board of Managers every Board of Legislator meeting, and if you've attended those men and women are not shy about asking me, what's happening with our health system. Appropriately so, we have a responsibility. So that hasn't really changed, and that has been in place, the entire time I've been here. And I think the feedback I've gotten from county leadership, the legislators, and the managers, some good feedback that, they are pleased with our attention to detail in those areas.
Even with the significant decrease in revenue that you're seeing because of the COVID-19 situation, are there areas where you're seeing like a significant rise in expenses in any particular area or piece of the equation? Adding in a new blood draw lab, things like that. Are you seeing like increased expenses due to that in addition to the lost revenue?
Basically the blood draw lab, the drive-in OBGYN clinic, we're using the same staff. We have the equipment. In fact, the blood draw lab is being administered by our lab director. So these are costs already in the system. Probably the cost that we've seen is the same of everyone else. This effort to surge up the expense of PPEs, the expense of all of the protective equipment. We've purchased these units that allow us to create 10 negative pressure rooms. Because when a community is hit with a surge of COVID-19 patients, you want to, if possible, put them in a negative pressure room. So those are the expenses that were not planned for and were pretty dramatic. Haven't done an inventory of all of those expenses because they continue. And in my call with Congresswoman Stefanik yesterday, I did reflect to her and Haney's in the past and our senators. There is a degree of price gouging going on, and I think it needs attention both nationally and regionally. And I know our elected officials and leaders are clearly aware of that.
And do you think the plan calls for a reduction of 35 FTEs over the next 8 weeks? Do you think that's enough to bring you to the break-even point you're looking for? Or is it going to have to be reevaluated on a constant basis?
No, it won't. Good question. With the attention to detail and managing our schedules, that has generated about a little over $250,000, actually $270,000 worth of savings. The leave will generate approximately a $250,000 in and of itself. You put those two together, and if we can sustain it, that's $500,000 a month. But you know, we're not reducing the staff at the nursing home. We're not reducing the staff at those areas that are off limits. And we still have to run the ED, medical surgical, the lab, radiology. So there's a basic level of staff, even if no one came, that we have to be able to provide. So in the aggregate, to create a 14% differential in staffing through our actions, and it only impacting 7% through these voluntary initiatives and involuntary initiatives, I'm actually incredibly pleased with the work of the management team.
Thank you.
Okay, well, thank you. Great questions today, folks. And you know how to get a hold of me if you have additional questions.
All right.
Thank you.
Thanks,
I didn't mean
Jerry.
to take all your time.
Oh, we
we're out
still
of
got more time.
Smile, Jerry. Hope you know.
That's
Great, thanks. Okay, we do want to run through just a few things from the county perspective. We'll try to be quick and then take some questions as well. We have at this point tested 220 people in Lewis County. 196 of those tests have come back negative, which is great. We're waiting on results for 14 tests, and we have had 10 positives, which has been widely reported. Something not quite as widely reported is that of those 10 positives, 7 people have recovered. So we have some good, 70% have recovered, and the others are fairly recent, and so we're hopeful that they will have a recovery as well. So that's good news. We want to talk about masks a little bit. There is a new executive order. Any public place where social distancing cannot be observed, people need to be wearing a mask, okay? So that is the new executive order from the governor. Masks, actually, I'm not going to talk too much about masks. I'll let Ashley take care of the specifics.
So I first want to start off by saying that masks are not a substitute for social distancing or washing your hands, disinfecting frequently touched surfaces, or staying home as much as possible. They are another tool in our toolbox to slow the spread of this virus. And I want to also clarify that it doesn't necessarily need to be a mask that individuals wear when they go out in public. It needs to be some kind of cloth covering of the face, or of the mouth and nose. And that is to contain the infectious droplets that a person may potentially be carrying.
Great. So the other thing we want to say about masks is that there's another executive order that says essential employees who are interacting with the public must be provided a mask by their employer. So if you are in a business that is essential and you are working currently and you're working with the public, your employer is supposed to be providing you a mask. So if you don't have that, you need to talk with your employer and figure out a way that you can be protected while you're working on the front lines. We are going to do our best as a county to do more mask distribution. The Department of Social Services and Office for the Aging have a distribution plan that we're going to kick off on Monday, but we need more masks. So this is an all call to our community. We've done a wonderful job making masks like this. We really have done a great job, and we've distributed hundreds of masks, but we still need more to distribute. So now that the mask order has expanded and we have more scenarios where people are going to need masks, then we really need more people to chip in and help with mask production. So we're asking you, if you've got a sewing machine, contact Office for the Aging. They can get you the, what do you call it, print, the sewing,
Template?
the template. Thank
There
you.
you go.
Yes, the
Pattern.
template. The pattern,
I
yes.
wanted to see how that would go.
Yeah, so if you have a sewing machine, contact Office for the Aging. They have a pattern that is available. They'll show you how to make the masks, and if you've got some time, you're sitting at home, we'd love if you could help us out, make some more masks, and we will try to distribute them out to the entire community the best that we can. I want to talk about what Ashley said about social distancing. So this is not a time to let up. We always said from day one that we felt our peak could be 2 to 3 weeks after New York City's peak as the virus moves upstate. So if New York City is just kind of cresting and getting over what could be their peak, then it is not time for Lewis County to relax. It is time for us to be as vigilant as ever and to truly respect social distancing and make good choices. Okay, I want to ask everybody that's listening, if you tested positive tomorrow and we had to do a contact tracing on your life and every place you've been and every person that you talked to, how would you do? Would your job be easy? Would you have made Ashley and her crew's job easy, or would you have made it very, very difficult? And so think about that. Think about the decisions that you're making, and we can get through this. It's only going to be, hopefully, another month or so. But it is important. It is not a time to let up. We have been fortunate so far, but that does not mean that the virus is not here, and it does not mean that we're not still susceptible. So make good choices. Stay home and be a good neighbor and a good citizen. Speaking of good choices, this weekend would have been the Snert Run up on Tug Hill. There are still folks who are saying on social media and who are saying in the community that they plan on coming here to ride. That is a bad decision. You are not welcome here to ride in large numbers right now. It is against the state's executive order. It is against our local trail law. The trail system is not open, okay? So we will have law enforcement present on the Tug Hill this weekend. The fine for gathering at this time in New York State is $1,000, and there's an additional fine for running our trails when they're not open. So we want to be crystal clear on that. Not a great time to come here. Please respect the public safety of our community. Please respect the wishes of the county government and county leadership. And we promise that Lewis County will welcome all riders with open arms, as we always have when this whole social distancing effort is done. When we're through with the COVID-19, we will have a bigger, maybe a bigger ATV run than ever before, and we'll support those businesses. And we love the economic activity, and we love to share our great resources with people from all over. But this is not the time, and this year is not the year to come. So please do not come to Snert Run this year. The event is canceled, okay? So if you're coming, you're just coming to ride on your own, and we're asking you to not do that. Last thing I want to plug is our Take 5 initiative. Take 5 is a simple concept. Take 5 minutes every day to call someone who's in isolation. So if it's your grandmother, a neighbor, an aunt, a sibling, a friend, somebody who you know is in isolation, who hasn't had a lot of social interaction, take 5 minutes every day, give them a shout, ask them how they're doing, share with them how you're doing, and be a good neighbor, be a good relative, and let's take care of each other, because it's hard to be socially distant for weeks and weeks on end. So take 5 minutes and call somebody. Simple concept, but it'll mean a lot. So with that, we'll take any questions that you guys have.
Ryan, we started out with, We started out with Jerry talking about furloughs at the hospital level. A question we've been getting from readers a lot lately is in effect to the county side of things. So people are noticing that they have a lot less access to services that they expect to have, obviously, understandably.
Yeah.
But they're wondering things like the DMV, the county clerk's office, places like that where they're not really having access to the services.
Sure.
Are you looking at furloughs in departments like that as this prolongs, or what's the process there?
So great question. There are counties across New York State that have implemented furloughs already, and there's counties that are thinking about it. In my opinion, the discussions that we've had, that is something that would be a measure of last resort for us. To the last thing you want to do right now is put an additional burden on the economic support resources that we have at DSS, right? So sending more people to DSS at a time when they're already overwhelmed is probably not a smart decision. I will say this, when it comes to the DMV and the county clerk's office, those are revenue generating offices. So even though they're not open to full staff right now and the public doesn't have the access they used to have, they are still processing dealer work. They are still processing things through the county clerk's office that generate the county revenue. So that's an area that we wouldn't want to furlough staff because they're still making money for us. And the state DMV is taking all dealer work right now, and so they're pushing some of that work back to us. So our DMV staff, though they're not with the public, is still remaining busy and is still generating revenue. Then you start looking at other things. Our largest department outside of DSS, which DSS is very busy right now, as busy as ever. The things at social services are essential. Child protective services are essential. Adult protective services is essential. Getting people signed up for SNAP benefits right now is essential. Getting people help with their unemployment is essential. So DSS is our largest department. There's not a lot that you could cut there. And also 75% of our expenses at DSS are covered by the state. Okay, so then you look at the Sheriff's Department, our next largest department. There's not much there that you could cut. We're already, operating at pretty much minimum staff, so that's not an option to cut folks at the jail or on road patrol. And then, you get into public health, which is a large department. They're as busy as they've ever been. So, it's hard to find areas that are not essential. A lot of what we do as a county government is essential. So something we might think about in the future, but right now it's not an option.
Thank you.
Yep.
We had a craft employee anonymously express that they are really worried because everyone in the string cheese and cream cheese department was exposed to the individual who ended up testing positive. They also expressed that Craft at this time isn't allowing masks to be worn. So are you in agreement of Craft for staying open despite the positive case and the mass exposure?
So I'm not going to talk specifically about the Kraft Heinz company. That is a question for their spokesman, which is fair. We're the government. It's not our job to do that. But I will say this. Food processing facilities, dairy processing facilities are absolutely essential for two reasons. One is that our food supply chain is essential. Getting people food and dairy products is absolutely part of essential service during a pandemic. The second thing is that we have a dairy industry in Lewis County, and anyone that has spent any time around dairy farms knows that the cows don't care whether there's a pandemic. They still need to be milked, and that product still needs to be moved. And so on that level, these food processing plants are essential as well. So I can't speak to the internal policy of Kraft and what they're doing for employee safety, but I can tell you that in general that it is absolutely an essential function, and we're glad that they're continuing to operate right now. Yeah.
But the CDC actually has guidelines in place for food service and plants like that have had a positive case at their facility. So isn't it public health's role to kind of make sure those policies are being adhered to at a local level?
Yep, and we have been in close contact with them and working with them to ensure that they have the latest guidance in regard to how to properly respond when there is a positive COVID-19 case identified. And we have completed a thorough investigation, and all contacts to the positive case have been quarantined.
Okay, and I kind of had some statistics written down. So obviously we get our daily report from public health on the number of tests we've done, the number of people that are quarantined and things like that.
Yeah.
I guess I'll lead this question off with asking, when exactly did the public health department first find out about the Kraft case? Was it the 9th case or the 10th case?
It was our 10th case.
Okay, so you found out on Tuesday?
Mm-hmm.
Okay. So when we're looking through the numbers, the report that we got on Tuesday morning said 201 people had been tested with 29 people in quarantine. The following day on Wednesday morning, which I think is when you guys announced the positive case at Kraft, we had 203 people were tested, so only 2 more than the day before.
Mm-hmm.
And then quarantines went up to 62,
Mm-hmm.
from 29 to 62. So you're looking at about only 30 people were put into quarantine based on about 400 employees there. I know there's different shifts and things like that, but if you could get, for people to understand, the question that we've been getting is, how come people going into quarantine, if they've had exposure to a person with COVID, why aren't they being tested? There's a lot of spouses of Kraft employees in the family. They might work at the hospital, they work in lots of different places in the community. So people are just wondering, why aren't those people being tested and they're just being stuck in quarantine?
So they're being put in quarantine because from 14 days from the exposure, because that is the incubation period for the virus. So we could test them, even though they're asymptomatic, but just because they tested negative today doesn't mean that they're going to not test positive next week. So it's important we do the quarantine to monitor them every day to see if symptoms develop, and to isolate them from the rest of the population to contain the potential spread of the virus. And in regard to the statistics of the number of people in quarantine, and you say, only about 30, well, there's any negative results that we would have received for individuals who did not have exposure to a positive case but were tested and their negative results came back that morning, they would have been pulled off of quarantine. So there's multiple variables in our quarantine numbers. There could be individuals who have returned from travel who are quarantined and they happen to come off that day. So it's not just adding, those additional people who we identified the day before.
But at most, 62 total people were in quarantine. So I guess the better question might be, can you kind of explain how you determined which people at Kraft needed to go into quarantine?
Yep.
Was it only like the immediate neighbors at the station on a specific shift?
Anybody who would have had contact within 6 feet, had a conversation with the person, not just in passing, but actually had a conversation, worked within 6 feet, anybody within those parameters. And I will tell you, we are extra cautious in comparison with what the CDC says. The CDC says anybody within 6 feet for more than 10 minutes. The state has provided a guidance in regard to proximate contacts, which would be anybody in the same classroom size room or same gathering. So those are the guidelines that we use. And we use multiple sources. Investigating is talking with multiple people about the same situation and verifying information is correct. It's not just taking one person's word. The investigation takes hours and hours, and we continue to field phone calls with concerns and questions, and we welcome those phone calls. We want to address the fears that people have, and I think we've done a great job with answering their questions as they call.
Is there any concern about surface contamination? I mean, proximity to people is one thing, but there's break rooms, there's kind of anybody on the shift could have gone and sat at the table after people who were directly exposed. So
Right. So if people are, well, I'll first speak to cleaning. If routine cleaning and disinfection is being done, that is important. Hand washing, as long as people are hand washing before they're putting food in their mouth, touching their,
Yeah, but sitting
eyes,
at a table and you're eating lunch, even if you wash your hands first, you sit down, you touch the chair, you touch the table, you
wiping things down.
in the staff room.
Yep. And there's other measures that have been taken in regard to separating people out in those kind of
That
settings in
craft
regard
specifically
to.
was already doing.
Yes.
Okay.
Do you feel that they have been cooperative and have been responding to everything that public health has advised them to implement?
Yes.
Thank you. How effective, actually, if nobody else has a question at the moment, so we've been seeing a lot of, with the new thing on the wearing the face coverings and things like that, we've been seeing a lot of information out there. I was wondering if you could just verify and kind of help people understand. A lot of people are sharing information and things like that pretty much say the cloth face coverings are ineffective
They're very
versus a virus.
They're very effective in containing the droplets that are spreading the virus. So covering your nose and mouth is keeping those infectious droplets contained. So wearing the mask, wearing a cloth face covering is about protecting other people, not necessarily about protecting yourself. Now there are a wide range of studies in regard to the varying level of masks with filters, just cloth, all the different materials, and how effective they are in actually filtering exterior particles from infecting you. And so I can't give you a clear answer as to how effective they are in filtering, but that's not why we're pushing people to wear them. We're pushing them to wear them to protect other people from their own infectious droplets.
I think that's helpful.
I think that's a point worth hammering home here. Wearing a mask is about being a good neighbor. It's about protecting the people around you. This cloth mask might not protect you from getting someone else, but if you're wearing it and everyone else is doing their part, then we all have nothing to worry about. So nobody is too cool, too manly, too anything to wear a mask. You absolutely should be wearing a mask if you're in public. Ashley and I would be wearing them right now, except for the main point of this is to communicate with the public, and it's hard to do that with a mask on. But the point is, when you're in public, if you're, like Governor Cuomo said yesterday, if you're walking down the street and you're able to social distance, great. You don't need to be wearing your mask. If you get to a crosswalk and there's 5 people waiting for the light, put your mask on. That's how you protect those other people, and everybody needs to be doing it.
Would it also follow, though, that while it's to keep droplets in, if both people are wearing masks, it's hard for anything to get between you anyway?
Absolutely.
You know what I mean? Like, it's, even if normally it would get through a looser fabric, if both people have it,
Extra protection.
it's not like they're supersonic. They're lightweight, right? Those droplets. So having
Yes.
those barriers on both ends is part of it.
Yes, absolutely.
More the merrier.
Yes.
So it wouldn't be a press gathering without this question, and I see it popping up in our live feed already. So we'll just kind of ask. We have covered it in the past, but can you just explain for people again why Lewis County isn't releasing data by municipality, town, whatever, as other communities are going? And I will tell you that we were on a press call with Congresswoman Stefanik yesterday. And this question did come up, not for me, from someone in Clinton County, a reporter there, because I guess Clinton County isn't reporting data like that, but some neighboring counties like Essex and Franklin are. And Congresswoman Stefanik's only comment was that she thought it was best for public health to put out all information available that they could without identifying somebody's personal health data, because it's much more effective than the rumor mill that you see that happens when the information isn't provided. So
I'll take that one, actually. So 2 things. The first is we have 26 towns and villages in Lewis County. We only have 10 positive cases. So how would you like to be the one person in Martinsburg or the one person in Port Leyden that is positive? And every single person in the county wants to identify and find who you are and where you've been and where do your kids work and should they be working. And I think I had a conversation with their aunt last week. Nobody wants to be that person. And it's not the government's responsibility to identify those people. So that's reason number one. Reason number two is that you are simply not safer going to get your groceries in Copenhagen rather than Krogan, or Lions Falls rather than Lowville, because there's a known case in Lowville and not a known case in Lions Falls. That does not make you safer. And so people that think they're going to game the system, and well, I'm in Osceola, so I can go have a bonfire party and a garage party because we are safe in Osceola, is wrong. And so providing a map of where these cases are encourages that type of behavior, and that type of behavior makes everybody less safe. So that is why we are not going to provide that information, and we've been consistent with that message, as have Jefferson County, and we're going to stick to it. So
I've had people concerned that they're making these masks and they're sending them to the Office for the Aging, and they think they're going to the elderly population, but then they hear they're going to other county employees and they're being distributed in other places, which you hit upon earlier. But can you just explain why that is? It's my understanding that most of the elderly population on the routes for the OFA have already gotten masks first. But could you explain what's going on with all of that?
yeah, so absolutely right. Anyone who has signed up for any of our Office for the Aging programming has already received a mask and a pocket-sized hand sanitizer. Obviously, there's more elderly in the community, but we're not just going to knock on doors of where we think old people are and give them a mask. We have masks, and we also have a need for masks, and as long as there's a need and a supply, we're going to distribute what we have. So,
where is that need you mentioned earlier, by the way? Who do you need masks for?
What do you mean?
Well, you said you have a great need, you want more people to sew masks,
yeah,
so where are they heading?
Whoever, we're hoping that we can distribute them throughout the county. So set up a distribution point in the south, in the north, and somewhere in Lowville, and allow people to come and pick them up.
So anybody that needs one could call and say, hey, I need a
Well, at
mask.
this point, if you're living in New York State and you plan on being anywhere in public, you should have a mask. So getting people to produce more masks and getting a wider distribution is going to help everybody.
With that comes the question of enforcement for all of these executive orders, right? We talked about that a little bit on the last call. It should be for law enforcement. I spoke to law enforcement. They said it should be public health. Where is the enforcement? You said for SNRT, law enforcement will be there. That's a pretty particular situation. Every weekend, though it's not SNRT weekend, people are gathering in various parking lots, and that's been an issue. Grocery stores are packed well beyond social distancing, not the big ones, but the smaller mom and pops on the weekends, many. There are certainly areas. Is there any enforcement? Is it possible to enforce?
There is enforcement. The state has a tip line that sends an email directly to the sheriff and myself and public health. And so we are following up. I personally have called several businesses and nudged them in the right direction. It is a difficult thing to enforce with law enforcement because you don't want to arrest somebody for not paying attention to some of these things. But at the same time, it is serious. There are fines associated with not doing the right thing, and businesses who have licenses to operate those, they continue to be bad actors, their licenses will be placed in jeopardy. And so we are trying to follow up on these individual cases as they come up. Some of them are quite hard to follow up on, like people in a parking lot on our trail system, went out for a ride and then stop and have a picnic, and there's 15 of them. By the time we get there and shake them up, and then they drive another mile down the road and keep going. I mean, it's hard to. Some of these things don't have a good answer, but the ones that we're able to follow up with, we do. And the sheriff's office their line is open for complaints and tips, 376-3511. So they are doing their best to follow up with these things as well.
And is the sheriff's office the only one with the enforcement authority? Public health doesn't really have enforcement authority as far as like writing tickets or issuing fines?
No, because we're a partial service health department, we do not have that authority. However, we do work with the Watertown District Office, the New York State Department of Health. They are our environmental health. So any business that would be monitored by them, they could find them. And then obviously ag and markets with other businesses.
So I guess I was thinking more along the lines of, we had talked earlier about how employees are supposed to be providing masks to essential employees that are actually working with the public. I don't really see it as an issue here in Lewis County as far as employers not doing that.
Kitty's wasn't giving masks, they just had the shield.
But what I'm asking is, if an employee does feel comfortable or has reached out to their employer and can't get the mask, what would their next step be? To reach out to public health, or
They should
I don't think they're going to
use the state tip line, which is an online thing. I'm not exactly 100% sure how it works, honestly, but there is a state online. You can be anonymous and report things, and also they can call the sheriff's department. That is absolutely inviolate. An executive order is a law. Okay, so we might not agree with 100% of what the governor has put forth, but it is a law, and there are consequences to breaking the law. So absolutely, if an employee feels that they're not being provided what they should, they can call my office, they can use the state tip line, or they can call the sheriff's department, and we will follow up with that. But like you said, for the most part, a lot of this stuff is changing very rapidly, right? So these executive orders come one at a time, day by day by day. If you don't sit down and watch the Cuomo briefing every day, you could miss something.
Right.
So I don't think we have employers that are being willfully ignorant and dangerous. I think we have folks that are struggling to keep up with their business, and also all the executive orders, and sometimes it's hard to get the equipment that you need, within 12 hours so that your next shift is ready. So I think we have to be reasonable about what we expect from our employers, but also recognize that these are state laws, and they do need to be followed and enforced.
And while we don't necessarily enforce at Public Health, we certainly do educate, and we have done a lot of education and reaching out to the businesses to make sure that they understand all of this rapidly changing information.
Okay.
Are
And
businesses reaching out to clarify? Are they trying? Are they
Some of
doing
them
their
are,
part?
yeah. Mhm.
so just referring to the public health department, obviously in Lewis County, like a lot of other departments, we run on bare minimums with a lot of things. So I'm sure, our public health department is small compared to a lot of places. Not saying you're understaffed or anything like that. I mean, you have the people that you need. But I mean, this has pretty much been an everyday, 7 days a week since March 15th. So just wondering how your staff is holding up, and are you getting relief from other departments or other agencies so your people can have a day off once in a while, or how's that working?
Yep. So we have instituted a staffing plan in which it allows staff to have a break, have a day off. We regularly meet together to make sure everybody's doing okay. This is a high stress situation, so we like to make sure everybody is doing okay. Our staff have been wonderful. We have worked hard, but that's what we do. We are public health, and this is what we respond to. So as much as it's a stressful situation, it's also brought us together, and I'm very proud of all of them.
Usually your job is planning, and then so
this is responding, yes.
Right.
For our years of planning.
Can I just ask you with testing? I've wondered, does the hospital and the county, is there reimbursements for that? Is that a source of revenue for the hospital at all? Like with the drive-up clinic and what have you, they're staffing it. They've got people coming up. The tests you have to pay for, the county or the hospital, or are they just given their part of the Department of Health? I've just wondered,
I believe they're
They're
billing
covered.
insurance for
They
that.
are billing insurance, so anybody that comes in, their insurance pays, or they have to pay out of pocket?
No, that's a
Nobody-
law.
Right.
Families First, I think,
Yes.
made it so nobody has to pay for a test.
Okay.
Right,
I
nobody
wasn't
has
sure
to
about
pay
that.
for that.
Yeah.
Okay.
COVID testing and COVID care is, must be covered by your insurance right now. So, but, you know, a test, I'm not sure what the hospital's billing for a test, but let's say it's $95 on the high end. You know, that's not going to substitute a knee replacement. So,
No,
you
of
know,
course.
that's the issue.
And with that, with testing, St. Lawrence County announced that they're ramping up testing quite a bit, and they're going to start to be testing more, even people without necessarily symptoms or without as many symptoms as have been required. They've had 100 cases, so they're in a different position. However, that has been on the national plane of discussion, that testing in places where there's smaller numbers, actually testing, getting to the point where you can test people, that's when you know that you can contain it, because you'll see what the spread really is.
Yep.
Is there any chance of that happening here?
There is the chance of it. I'm actually currently waiting on 2 guidance documents from the state in regard to the different levels of testing and exactly what we should be doing, how we should be interpreting the results, and then how we should be reporting that as well. So until I have written guidance from the state, we're kind of in a holding pattern, still testing everybody who's presenting with symptoms, and you know, encouraging the correct individuals to come and get tested, because we want to find our positives. But as far as necessarily ramping up right now, I don't have a definitive plan to do that yet.
Is it any easier to get tests? I know you had ordered at one point like thousands of swabs. You got hundreds in return. It was enough for what you needed at the time, correct? Is it getting a little easier to get tests that you need? To order more, to restock?
I would have to defer that question to the lab director at the hospital, as he's the one that's ordering. I haven't heard that we've had any issue with our supply as of right now, but
I can answer that a little bit. We do have a decent amount set aside. However, you can see how one positive case can trigger multiple tests. So yes, we've been doing okay with our testing supplies, but we always anticipated that we'd have more cases. And the more cases you have, the more testing you have to do. So we're okay for now because our numbers have been low. If our numbers, you know, get much higher, then we'll go through testing kits a lot faster, and then we would be, I think, back in the same boat of trying to make sure we had enough supplies. So yes, we're okay right now, but that could change.
Any updates, Ashley, on the serology or antibody testing, and when we might see that? I know it has rolled out in some places, so.
yes. So downstate, they are doing studies on it. So the antibody testing, there's a lot yet to be known.
Yes.
Specifically what antibodies a person needs to have, how much of that antibody or the titer, and then how long that immunity is good for. So there's a lot yet to be known in regard to the antibody testing. And again, that kind of testing will be addressed in those guidance documents when I receive them from the state.
Perfect. I'm good.
Satisfied, thank you.
Okay, great. Thanks, guys.
Thank you.
Thank you very much.
All right, what do you think? Can we do this once a week? You're good with as needed. Nick, what do you want? Once a week or as needed? For
At
these
least
press
once a week.
conferences? At least once a week.
As
So we would
needed.
probably request to
Once
at
a
the
week.
station.
Okay. We can do once a week.
Yeah, if it's once a week,